Good morning everyone and welcome to my presentation where we are investigating the effects of respiratory therapy on pulmonary functions for patients with cerebral palsy. My name is Erika Kolumbán. I'm a conductor-teacher working at András Pető faculty, and my research was carried out under the guidance of Ibolya Túri, Mark Hernátfői and Daniel Veres. As a conductor working daily with children with cerebral palsy, my vision is to improve the quality of life of my patients through a better rehabilitation. And my mission is to improve the condition of cerebral palsy patients by applying evidence-based breathing exercises into the standard care. With this mission in my mind, we set up two specific goals. The first one is we are investigating the supplementary respiratory therapy in improvements of pulmonary function by conducting a systematic review and meta-analysis. And in the second one, we are investigating the effects of the conductive breathing exercises on pulmonary function by designing a study protocol and conducting a randomized control trial. Firstly, I would like to introduce to you our first project and a few words to the background. Cerebral palsy is the most common disability among the children and which affects not just the neuromuscular system but also the respiratory health of them, and is the leading cause of death among these patients. The respiratory status is also very closely linked to the self-care activities and social adaptiveness in their daily living and activities. The current consensus statement in this field advises us professionals to perform regular assessments in respiratory health and also to conduct preventive exercises in the rehabilitation. A child with cerebral palsy undergo conventional therapy. So the standard care means physiotherapy, neurodevelopmental approach, or conductive education, which focus mostly on the motor development, cognitive development, and social development. However, there are existing supplementary respiratory therapy with the help of device, manual techniques, or breathing exercises in playful manner. The issue is that the standard care does not include the supplementary respiratory therapy in his regimen. Therefore, we investigate the effectiveness of different kinds of therapies on pulmonary function and respiratory strength. The clinical question would be, if we add this kind of different respiratory therapies, will improve the pulmonary functions and the respiratory strength compared to the conventional one. We included patients with cerebral palsy who receive standard care and additional respiratory therapy versus conventional therapy alone. We search for measurable changes in pulmonary function, respiratory strength, and quality of life. Our hypothesis is that supplementary respiratory therapy will be beneficial for our patients' respiratory health. We conducted a systematic search in 5 major databases, and here you can see the flowchart of our selection, and we could recognize 12 eligible articles, and these 12 eligible articles allow us to extract outcome measures of mean difference. Regarding to the pulmonary function test, one of the very important parameter could be the peak expiratory flow measurements and values, which represents the speed of expired air. It could be measured in percentage and also in liter, and here you can see on the right side of the line 0, the studies who favors to the intervention group, and on the left side who favors to the control group. we find in the values on liter a statistically significant mean difference. However, it's most important beyond statistical values that both of the values are considered clinically an important change, and we conclude that after intervention this volume will increase in our population. Regarding to the respiratory muscle strength, which is measured in water centimeter and is expressed by inspiratory pressure and expiratory pressure, we find also clinically meaningful change. However, doesn't reach the statistically significancy, and we find also a high level of heterogeneity. But we were able to figure out what is the reason of the heterogeneity. It's the intervention, different intervention length, different type of interventions, and also the included population was really severe. Regarding the quality of life, I was disappointed because we couldn't perform a meta-analysis, but the literature suggests also that will be improvement in certain quality of life domain after giving supplementary therapy, respiratory therapy for CP population. The strength is that we included only a randomized control trial. We identified the sources of heterogeneity. We followed a rigorous methodology, and we also identified errors in previous analysis, and our is more meticulous. The limitations is related to the quality of life values, the high level of heterogeneity, and relative small sample size. In conclusion, in all pulmonary parameters and respiratory muscle strength, there was a clinically meaningful increase, and that would be beneficial for children with cerebral palsy. We highly recommend for the practice to incorporate this additional respiratory therapy in the standard care, and for the research it would be very important to conduct investigation regarding to quality of life. Here you can see the manuscript status, and we are ready to finalize it. And I would like to move on the second project, which investigates the effectiveness of conductive breathing exercises. To the background, the Hungarian physician András Pető in the late 50s developed the Hungarian complex rehabilitation model called conductive education, and it's worldwide acknowledged since 80s. His novelty is not just the effectiveness and the high benefits of the program, but also he's already in the 50s included breathing exercise series in order to improve the pulmonary function, to strengthen the respiratory muscle strength, and to improve the health-related quality of life of the cerebral palsy patient. But unfortunately, he didn't left for us a clear protocol, and until now there was no research on this field. So in order to gain proof to evidence-based conductive education, we need a randomized control trial with the question, does the protocolized conductive breathing exercise change the pulmonary function of children with cerebral palsy? And we would like to write a protocolized conductive breathing exercise series, and to compare with the non-protocolized one, and to measure changes in pulmonary function, muscle tone, quality of life, and anxiety. And the clinical implication would be that that adding and using the protocolized breathing exercises will improve the quality of life of our children. As a first step, we analyzed the manuscripts of András Pető with content analysis, and analyzing 8,000 pages, we find more than 1,700 hits regarded to the breathing patterns and exercises, which was very important lesson for us that independently from diagnosis, there are several breathing techniques which can be used harmful in each CP diagnosis. And the differences is only between child and adults and in the breathing exercise length. So I am on the way to finish our protocol based on this manuscript. And I'm planning to finish first our meta-analysis manuscript and now to concentrate on the second project. And I would like to end my presentation with a quote from Winston Churchill: "Success is going from failure to failure without losing enthusiasm." Thank you.
Regarding these randomized controlled trials, what you are planning and carrying out, all cerebral palsy children in school age are eligible for such study, or you should select a population where these conductive methods can really be applied? I mean that cerebral palsy is a spectrum. Yes. And those on the lower part of this spectrum will probably resistant to such method. What's your opinion about it?
Thank you very much for the question. Now, at the moment, we are on the. I'm designing this randomized control trial, and I am working at the Conductive Institute. So. We would like to include firstly children who attend and follow conductive education. Who is eligible for conductive education? The child must be able to understand comments, simple instruction, and the severity of motor status is for us not exclusion criteria.
Regarding the measurement of the outcomes, were they made right after the interventions for the intervention group, or at the resting phase?
No, right after the intervention.
Okay, Isn't that confounding in this case, or what do you think?
So there was 2 measurements before the intervention, and the intervention it took like 4 weeks or 6 weeks or 8 weeks, and there was a measurement after the intervention period.